Please subscribe Mumtaa for daily updates on pregnancy and baby care. In today's video we will share how C-section delivery can be avoided. Giving birth is a natural process that many women look forward to, but sometimes it can be necessary to have a C-section delivery. C-sections are surgical procedures that are used to deliver babies when natural childbirth is not possible or is too risky for the mother or baby. While C-sections can be life-saving in some situations, many women prefer to avoid them if possible. Here are some tips on how to avoid a C-section delivery. 1. Choose a healthcare provider who supports natural childbirth. One of the most important things you can do to avoid a C-section is to choose a healthcare provider who supports natural childbirth. Look for an obstetrician or midwife who has a low C-section rate and who is willing to work with you to develop a birth plan that aligns with your preferences. It's important to feel comfortable with your provider and to trust their judgment and expertise. Stay healthy during pregnancy. Staying healthy during pregnancy can reduce the risk of complications that may lead to a C-section. This includes eating a healthy diet, staying active, getting enough rest, and attending all prenatal appointments. Your healthcare provider will monitor your health and the health of your baby throughout your pregnancy and make recommendations to help you stay healthy. 1. Prepare for labor and delivery. Preparing for labor and delivery can help you feel more confident and in control during the process. This can include taking childbirth education classes, practicing relaxation techniques, and preparing a birth plan that outlines your preferences for pain management, labor positions, and other aspects of childbirth. 1. Avoid unnecessary interventions. Unnecessary interventions during labor and delivery can increase the risk of complications and make a C-section more likely. This can include induction of labor, continuous fetal monitoring, and the use of epidurals or other pain medications. Talk to your healthcare provider about the risks and benefits of these interventions and whether they are necessary in your situation. 1. Consider alternative birthing methods. Alternative birthing methods such as water birth, hypnobirthing, and acupuncture may help reduce the need for a C-section. These methods can help you manage pain and promote relaxation during labor and delivery. However, it's important to talk to your healthcare provider about these methods to ensure they are safe and appropriate for you. In conclusion, while C-sections can be necessary in some situations, many women prefer to avoid them if possible. By choosing a healthcare provider who supports natural childbirth, staying healthy during pregnancy, preparing for labor and delivery, avoiding unnecessary interventions, and considering alternative birthing methods, you can increase your chances of having a safe and natural childbirth. Remember, every pregnancy and birth is unique, so it's important to work with your healthcare provider to develop a plan that is right for you and your baby. Thanks for watching the video. Please subscribe channel.